Hello, my name is Hermes Novoa. This is Mike Loreno. We're doing this video as part of our Fundamental for Clinical Education's DMP class for anesthesia. And he's going to be representing the student, and I'm going to be representing the preceptor. This is simulated end of the day evaluation feedback of preceptor towards student. Okay. The first point that we're going to hit is anesthesia workstation setup and preparation. Okay. I really think you did a good job. I like the way you label everything. You know, date, time, initials. Everything was ready and set up. The only thing I would like to say, you don't really have to have everything open, especially since we want to make sure that we don't contaminate anything, that everything is ready and sterile for the patient. Sometimes the circulator nurse goes in and out of the room. There's things to do, or sometimes maybe the case delays and there's a long time between turnover. So things may get contaminated if they're open. So I know you want to be ready. That's always good. But keep in mind that you always want to maintain sterility and being as aseptic as possible. Okay.
So next time, just pretty much wait until we are actually going to be using it, then I'll open that up.
Yeah. Perfect.
Pretty much keep it sterile as much as possible.
Perfect. Yeah. So next will be pre-anesthetic assessment and patient preparation. Again, great job. I think you interviewed the patient smoothly, and the plan of care that you did was according to what the patient needed. One thing I would like to point out, next time you could include the family in the plan of care as well. Remember, not always everything we do is for the patient.
Gotcha.
Some of the care that we do also is with family. We have to educate them, because once the patient gets out of the hospital, it's going to go with the family.
Yeah.
So even though everything was smooth and great, next time if you could include them in your teaching, in your pre and post anesthetic plan, that would be I think that would be more comprehensive.
Next time I'll just include the family. A little nerve-wracking, especially as a student interviewing those patients.
Okay, Mike. So in this section of plan of anesthesia care, what do you think went right, and what do you think you need to work on?
So we did a total knee surgery. I believe that I did well on the assessment of the patient. I saw that he was going to probably be a difficult intubation, so I started off by getting the gyroscope inside the room beforehand. We didn't need to use it, but it was just a nice little reassurance that we had there. Throughout the case, I believe that induction went well, and management of the case went well. The only thing that I think I messed up on was actually just being too focused on one thing, and I wasn't aware of my surroundings, especially administering medications that we needed to be timely.
In that aspect, I'd like to say that next time will be good for you to keep in mind to communicate with the surgeon, because sometimes, for example, these type of surgeries require administration of TXA. And then some surgeons want them before, some others want them after or during the knee replacement. So in terms of knowledge base, I think you did a great job. You really knew, your equipment, your pharmacology, patho, and how the procedures should be done. Even though you're only in your second semester and you haven't mastered, and you haven't been given the lectures for many of the content, I appreciate that you went ahead and that you studied. That's a great job. That's the way it is, because even after you graduate, you're still going to be learning stuff that maybe procedure you've never seen before, and you always have to read ahead and make sure you learn it before the case.
Do you recommend any book beforehand?
I will say Barrage.
Okay.
Barrage is a good book. The application of knowledge base to anesthetic patient care. I think we talked about this already. The anesthetic plan that you did, how you implemented, and knowledge base that it was great. I think pretty much you.
So pretty much we
did a good
communicate with the surgeon, right? Make sure that I'm not getting focused into one thing, and being aware of my surroundings. And that's
perfect.
That was the things that we did.
Perfect.
Right? Okay.
In terms of psychomotor skills, you're doing good. You still have a learning curve to go through. I think you're just missing a few things. Tiny details, but they can make a difference, a big difference. Especially like you're learning to intubate with the Mac blade. Remember to sweep the tongue, out of the way. Especially with this blade, you have to do that because it's so thick.
Yeah.
But the positioning was great. You did a great job with ramping up the patient. It was a heavy patient. So in terms of learning that, do you rather have me explain to you how it works? What to do better, or you want me to show you next time?
Maybe next time. Just I'm a visual learner, so I when I see it first from a person firsthand, then it kind of sinks in more.
So in terms of anesthetic management, the 3 stages: induction, maintenance, and emergence. I think you pretty much have the idea of how everything works. You have done a good job, especially in induction and maintenance. What I think that you should work on a little bit is on emergence, which is normal at your stage. That's the hardest thing to learn. Okay, just timing, because remember, not all procedures are going to be long and give you time to slowly emerge a patient. Sometimes you have like a cysto case or something that is quick, very quick. So it will be good for you to get used to the timing, in emergence. Use different drugs, use different gases as well.
I was going to ask you is how would I do the timing?
Documentation and patient report. The communication part, you're doing great. I saw you apply the SBAR algorithm, and just a little tip: try not to give too much information to the person you're giving the report to. Remember, straight to the point.
Okay. As we were explaining earlier, just straight to the point. Given the nitty-gritty details that
exactly
will make them more successful in PACU.
Exactly, you'll get that with time. It's not, but just keep working on it.
Okay.
So in terms of professionalism and teamwork, you're doing a great job. Everything was very safe. You created a safe environment for your patient and for us. So in terms overall evaluation, I think you're doing great. Minor things that you have to work on, but nothing out of this world. And I would like you to evaluate me and just tell me, what I need to do best. What I need to do better, or what I need to change, in order for me to teach you better.
Gotcha. No, I believe that you do a good job. I enjoy working with you. As you were saying before, sometimes you do jump in, but I would just say maybe if there's no patient harm or there's no immediate patient safety issue, just I would say let me do a little bit more and facilitate it instead of jumping in and taking over the case, and that's pretty much it. But everything else, all the objectives were put out first so that I knew what the day was going to entail. I knew what kind of setup that you wanted. You told me that ahead of time. A few little details that I kind of missed, but I think that's just, I've only seen you once, and exactly, with time I'll actually get to know what your preferences are, and then we'll be able to kind of blend a little bit better.
Sure. It's been a great day. Thank you.
Thank
and
you.
I look forward to working with you again, okay?
Exactly. Me too.